Hi, thank you for joining us for this episode of Healthy Living. Today we're going to talk about all about orthopedics. So recently we expanded the Bone and Joint Clinic in Covington, Louisiana. So to start the conversation about the Bone and Joint Clinic, I have with me Dr. Rock Hontus. He is an orthopedic specialist at the Bone and Joint Clinic in Covington. So welcome, Dr. Hontus.
Thank you, Amy. Thank you for having me this morning.
Thanks so much. We know that the expansion has occurred and it's beautiful. I wanted you to speak a little bit before we talk about the Bone and Joint Clinic expansion. Talk about the history of the Bone and Joint Clinic to this community. What does it mean?
The Bone and Joint Clinic is the oldest orthopedic clinic on the North Shore. It was established originally in the 60s. And my brother, Mark Hontus, joined the office in the mid-80s. And it has continually expanded since then. And when you include our brother group of orthopedists with Ochsner Clinic, it is not only the oldest, but it is the biggest orthopedic clinic on the North Shore.
And a very comprehensive slate at the Bone and Joint Clinic.
Well, that's exactly right, Amy, and that's exactly what our intent was. Originally, as I said, it was just my brother and I for many years, and then we joined the Ochsner Group with our affiliation with them, which essentially gave us 4 immediate new partners. And then in 2016, Dr. McDaniel joined us. 2017, Dr. LaMartina joined us. And then just this January, Dr. Matthew Webb joined us. So when you look at all of their specialties, it is by far the most comprehensive orthopedic clinic on the North Shore. You'd have to go to New Orleans to find the diversity of interests and specialties and talents that we have in our clinic.
That's wonderful to know. And it's nice to know that you can stay right here and get the care that you need. So when we talk about the Bone and Joint Clinic expansion, why did you expand? What made you want to do that?
For a couple practical reasons, Amy. First, as I said, my brother and I had been in the office together. We had thoughts about expanding. When Ochsner came on board in 2013, it gave us a little bit more flexibility. But then when we really made it our intent, and with the total backing of the Board of Commissioners and the administration of the hospital, that we were going to expand and make this a very comprehensive clinic, quite frankly, we just needed more room.
Yeah.
So it really took on a life of its own. I believe it was probably 3 or 4 years ago when we first started developing the concept of the addition. Shortly thereafter, we felt that adding about 2,000 square feet of space for physical therapy would be a benefit to our patients.
Right.
So we included that in the expansion. And then it gave us room for Dr. McDaniel's practice, Dr. LaMartina's practice. We were anticipating adding Dr. Webb at that time. So it really came about all at once, and it really benefits not only us, but certainly the patient flow through the office as well.
Yeah. So what are some little amenities that you are super proud of in there?
We have 25 exam rooms. We have 2 x-ray rooms. We have 2 cast or procedure rooms. As I said, we have about 2,200 square feet for physical therapy. We have 2 separate entrances. We have an entrance in the back for Dr. McDaniel's patients as well as physical therapy, and then a waiting area in the front for the adult orthopedic patients. So we have 2 entrances, which was a very, I think, works out very well for the patients. And just the way the office flows, in a sense, you have several offices all molded into one, but the flow is very, very beneficial for the patients.
Yeah, and you talked about the cast rooms, the x-rays. So if I'm coming in as a patient, there's a lot that can be done right there in the office for me.
Well, we really intended it to be just like that, Amy. We wanted to make sure that our patients don't need to leave. And when you add not only the Ochsner orthopedist, which gives us a much more variety of interests and capabilities and specialists there,
Right.
but then when you tie in the other specialties that the St. Tammany Parish Physicians Network has,
Yeah.
with general surgery, the vast primary care clinics that they have, cardiology, and all the other physicians that are aligned with the hospital, it really gives us the ability to make sure our patients can be treated here. If we need to refer them, we don't need to refer them to New Orleans. We can treat everybody here on the North Shore.
Right, and it gives you that collaboration too, I would imagine, where you're kind of bouncing ideas off of one another, talking about cases in depth and things like that.
Well, there's rarely a day that we don't refer either to one of the specialists at Ochsner or they back to us. And that's not even taking into account the referrals to, again, other physicians in the network. And it just makes it so much easier. We're on the same computer system.
Right.
So it's not like your primary care doctor is on this system, electronic record system, and then this doctor's urologist is on this one, and then your OBGYN is on this one.
Right.
Everybody's all in the same system, and it's really helpful in trying to capture information, and really it helps in treatment of the patient.
Yeah, streamline of care. I mean, it's wonderful.
That's no
so
question.
what are your patients saying about that new therapy space in the back?
Well, I'll be honest, I think they're much more willing to be treated there than I anticipated. Therapy is a very unique type of practice. Sometimes it's, certain therapists have their interests.
Right.
And then, of course, location is very important. It's hard for someone from Mandeville to come over to Covington, or someone from
Sure.
Washington Parish to come here just to go to therapy. And that's why you see so many therapists out there. But we were very lucky in getting a physical therapist, Cameron, who joined us in August of last year, and he's been wonderful in treating our patients. And now not only are we, before I even get to propose the idea of patients being treated there, oftentimes patients are asking, by word of mouth, can I be treated in the back? Can I have
Right.
therapy in the back? And of course the answer in almost all cases is yes.
Another streamline of care option. I mean, that's just so nice. Time, as a mom, time. It's the most important thing in my life, really.
Sometimes just walk on down that hall. and
Exactly.
We'll get you taken care of, and it's oftentimes we can start seeing them on the same day.
Yeah. So let's just talk about practical things in the world. Spring is here. Athletics are ramping up. You're an athlete yourself. You played for Tulane for years. Everybody knows.
In my
This is
previous
the
life.
original Dr. Rock Contos, okay? So what do you say to athletes, to coaches, to trainers? Because everybody's gung-ho. The weather's nice now. We're ready to get out. We're ready to start training. We're ready to start doing all things. How do you protect yourself? How do you protect your bones?
Well, a couple things that I could give as advice. First of all, know your body. Listen to your body, understand your body. When you get beyond the high school and college ages where you seem almost to be bulletproof, as you get older, those things, it's the same injuries, it's just the injuries affect you a little bit differently.
Right.
So there are very few things that we really recommend that you power through. Listen to your body. If your back hurts, if your shoulder hurts, if your elbow hurts, if your knee hurts, listen to it. Come see about it. Second thing, of course, is now with pickleball being so popular, we certainly recommend stretching.
Okay.
Before and after. People forget the importance of stretching after
What is the
working
importance
out.
of stretching
Well,
after?
when you work out, of course, your muscles are loose, you're stretched out, and then if you stop abruptly, then they're going to contract, and then you get stiff.
Okay.
This, by stretching, you maintain that flexibility, and really it's flexibility as you age that is the biggest, the most common thread as far as injuries are concerned. We lose our flexibility, and I always encourage patients, even before you get into any kind of problem with an injury, continue working with your flexibility, maintain your flexibility, and that may prevent some injuries from occurring.
That is really good to know. I really didn't ever understand the importance of stretching after. So I guess we're going to wrap up our conversation here. We're thrilled about the Bone and Joint Clinic. Let's say the location of it. The location of the Bone and Joint Clinic is at 71211 Highway 21 in Covington. And if you want to schedule with you, Dr. Rock, you would call 985-893-9922.
Yes, we encourage new patients to call that number.
Okay.
It's nice to get them in the system, and all of our receptionists can assist them in getting into the system. Established patients can also call that same number, but now we've learned between 75 and 80% of our patients are on MyChart. So established patients, we encourage, if they want to, if they're inclined to get on MyChart, and they can make appointments through that.
Very easy to do. So anything else you want to add?
No, we're just, I can speak for Dr. McDaniel, Dr. Webb, Dr. Lamartine, my brother, Dr. Mark, just how proud we are of our association with St. Tammany, and through that, with the Ochsner physicians. And we just appreciate all the help that the administration and Board of Commissioners has given us in getting our practice established as it is.
Wonderful. Well, thank you so much again for joining us. We loved having you here. And stay with us, because coming up next, I have Dr. McCall McDaniel. She is also at the Bone and Joint Clinic. She is a pediatric orthopedic specialist. So we'll be right back. Stay right there.
No bones about it. St. Tammany Health System's Bone and Joint Clinic is #1 in orthopedics. Along with our partner, Ochsner Health, we connect you to the very best care. Not just on the North Shore, but in the country.
Welcome back to Healthy Living. We are back with Dr. McCall McDaniel. Dr. McCall McDaniel is a pediatric orthopedic surgeon, and she is also working at the Bone and Joint Clinic in Covington. And let's say that location one more time, 71211 Highway 21 in Covington. So, Dr. McDaniel, welcome. Thank you for coming.
Thank you for having me, Amy. I really appreciate being here.
Yeah. So, I know lots about you. I would love you to tell our viewing audience a little bit about yourself before we kind of start talking business.
Sure, absolutely. So I was born and raised here in Covington. I went to Covington High School. I then transferred over to Alabama for my undergraduate, and then went to LSU Medical School in New Orleans. Did my orthopedic residency at Tulane, and then went to University of Utah for my pediatric specialty.
Okay. So you also work at the Bone and Joint Clinic with Dr. Rock.
I do.
And the whole team there. But you are a pediatric orthopedic surgeon, so that's a little bit different, and it's just a wonderful specialty to have here on the North Shore in our backyard.
Absolutely. Before I came, most of the patients in that age group were having to travel to New Orleans or Baton Rouge to be seen, so it's great to offer that for them here at home.
Sure. And you also benefited from the Bone and Joint Clinic expansion. You were part of that discussion, I'm sure, from the ground up. And what are some things that you are realizing from this expansion, and how are you benefiting and your providers benefiting there?
Well, it gave us a great deal of space that we were lacking before, which was great. I probably, to be honest, benefited the most from this expansion because they put me in the back with all the pediatric patients. We have a separate entrance for those patients, which has been great. Makes it kind of streamlined to get in the clinic and get back into the exam room and then get x-rays done and your cast all in one visit right in the same place. And I've been able to expand how many patients I've been able to see, which has been great as well. So we're very excited about this space and glad that we have this to offer to the community.
Yeah. So when what would a patient, when they come to you, what can they expect kind of from your practice, and like what's your kind of care philosophy at the clinic?
So, we try to make sure that we can take care of all the problems right there in clinic. X-rays right there readily available. You'll get your cast if you have a fracture right then and there, which has been great. Also, PT has just been added to our clinic, which is a wonderful expansion as well. So the patients come into the separate entrance, which is in the back of the clinic. They check in at the front desk. We room you as quickly as possible and try to get us X-rays as quickly as possible as well. We know time is of the essence. Parents have places they have to be and kids have to get back to school. And then our cast room room is right there on site with a cast technician ready to go if a cast is what you need. And then, of course, we try to make sure we tailor each care plan to the patient and what their issue is.
Okay. So we talked about the expansion a lot with Dr. Rock and just now with you. Let's just kind of discuss. I know that you and I have talked in the past about this corrective surgery you perform on scoliosis patients.
Right.
And I want you to talk about what is your team's approach and what's different about the way you do it.
So it's definitely a team approach from our standpoint. The patient comes in, gets evaluated in clinic, and if they have a curvature of the spine, and commonly referred to as scoliosis, the vast majority of the scoliosis patients that I see are adolescent idiopathic scoliosis, which is the most common form. And also the majority of those patients that have it usually just require observation and encouragement over the course of their growth. So we see them regularly for scheduled visits for x-rays and monitoring to make sure the curvatures don't get out of control. A lot of the times we'll also have to talk about surgery if there is a high magnitude curve. And obviously surgery is a big deal for any patient, especially for a pediatric patient. So we try to make sure that we go over all the ins and outs of what surgery is and what to expect preoperatively and postoperatively with the patient in clinic. And what's great about what St. Tammany can offer is we have a well-oiled machine in the operating room now and on the floor. So we have a team-oriented approach to it. It's always the same team in the operating room, which is great, which makes everybody move smoothly throughout the whole process. We also have a wonderful team on the floor that's able to take care of the patients, both in the PICU and on the floor, which is also a great addition as well to taking care of a scoliosis patient.
Sure.
Making sure that the family's comfortable and that the patient is comfortable, and then we share, care with both the critical care providers on the floor and myself, and of course our PA Danielle Napover, who's also a great addition to the clinic. So we also offer in the operating room something that I think isn't everywhere else. It's called the O-arm. And the O-arm gives us a nice 3D picture of the spine, and we have instrumentation that we can use to navigate using that picture after we get it in the operating room to show us exactly where our hardware is being placed live on camera. We can watch it on the screen. It's a really great addition, and I think it's great for safety. You want to know where your screws are placed, when you're placing them. And then after all of our screws are in place, we also then take another picture on the O-arm to confirm that what we thought was happening live is what exactly has happened. So we make sure that we know where our screws are before we leave the operating room, which not everybody can say.
So lots of layers of protection and follow-up, and like you said, a streamlined approach with the same team, the same routine every time.
Absolutely.
So
Absolutely.
very good peace of mind for the parent. So how common, I don't want to backtrack, but I do want to backtrack a little. It sounds like scoliosis is pretty common.
It's definitely something I see quite often in my clinic. The surgical curves are way less common, obviously, than the observation curves, but I see quite a few patients with scoliosis.
Okay. So what is the recovery time? Once you do your procedure, what's the estimated recovery time for a patient?
Estimated recovery time for someone going back to full activity, which would be, in my opinion, contact sports. Let's say if you're a football player and you're going to have this procedure, you'll be back on the field, hopefully, if all goes well, in 6 months.
Oh, okay. Good deal. So, all right. So let's talk about football in spring and all the athletics. It's warm outside. Everybody's back at it. We're walking, we're running, we're biking, we're doing all the things. I asked Dr. Rock this question, and he talked mostly about adults. I'm sure some of the same thing applies to children, but when it comes to children, what do you say to parents, coaches, children who can comprehend? How do you keep your bones safe during this time?
So we definitely need to work on a stretching protocol. So my baseball players, football players, all the athletes out there, certainly stretch before and after you get on the field. Practice and games, we don't really focus enough on stretching. I think that's absolutely necessary. We have a lot of baseball injuries from my overhead throwers. There's a whole protocol that you have to follow for shoulder and elbow care prior to throwing the ball. So a lot of times that's overlooked, so that can be something that can cause an injury for sure. And just for the kiddos out there on the playground and riding their bike, make sure you use all the protective equipment that you need. So just be careful out there. Wear helmets when you're on your bikes and your scooters. Listen to your mom and dad. Make sure you don't take unnecessary risks. But that's part of being a kid. So we're there to take care of you if you need us.
Okay. And so when you talk about this protocol, the team directors should know that, the coaches.
Yes. So it's definitely something that our physical therapists in the community are great at communicating with coaches, and I know that they love to discuss it with coaches as well that might not have an idea of what needs to be done. So I think that certainly getting in touch with even our physical therapy department to go over a throwing program and how to stretch before that is crucial to the health of the athlete.
So this is a question that as a mom I always had, and I always had to kind of call someone and ask them. I had a neighbor who was a nurse, luckily. But when you do get that little injury, say you think you sprained something or something like that, do you ice it or do you put hot? What do you do? What do you do immediately after, before I even call you?
Immediately after, you want to place ice, I think is the best option for
Okay.
it for sure. Ibuprofen, ice, rest it, elevate it. Obviously, if there's a deformity, we need to go to the ER.
Sure.
But most of the time at home, ice, elevation, and rest is the first step.
Okay, all right. So is there anything else you'd like to add? Anything at all?
No, I think we covered pretty much all of it. We're happy to take care of all these patients in our new area, which is great. So just give us a call over at the Bone and Joint Clinic, and we're happy to hopefully meet all of your needs here on the North Shore.
Well, thank you once again so much for joining us, Dr.
Thank you for having me,
McDaniel.
Amy. I appreciate it.
This was a great discussion. So stay right there. We'll be right back with Mike McNeil.
Kids should be seen and heard.
At St. Tammany Health System,
Many kids are being treated like, well, kids. We're not little adults, you know.
they have the North Shore's first kids-only ER.
And ICU. They even have a parenting center.
Kids aren't the only ones who need to go to school.
Together with their partner, Oxnard Health, St. Tammany Health System makes it easy to be on our side. On this side of the lake.
Welcome back to Healthy Living. So, in keeping with our theme, orthopedics, we're going to talk with Mike McNeil. He is our Director of Outpatient Rehab Services.
Correct.
So, yeah, thank you so much for joining us, Mike.
Yeah, good morning. Thanks for having me. Appreciate it.
Appreciate
Glad
you
to be here.
coming. So, tell our viewers a little bit about you.
So I am a physical therapist and athletic trainer. So I went to University of Southern Mississippi and graduated in sports medicine. From there, I went to the LSU Medical Center in New Orleans and got my degree in physical therapy. And so I've been practicing since 1997.
Oh, wow. And how long have you been with the health system?
I've been with St. Tammany for 7 years.
Okay, great. So we talked a lot about the expansion of the Bone and Joint Clinic. We're very excited about that because within that space is this beautiful physical therapy space. It's beautiful. So tell people, if they're watching, as the viewer, if you come in as a patient, what does that mean for you now?
Right. So first of all, from an outpatient rehab perspective, we're super excited to be a part of this expansion of the Bone and Joint Clinic. As you mentioned, it's a very beautiful clinic. It's about 2,100 square feet with a lot of special equipment, and it gives us a great opportunity to really focus care on orthopedic patients. So if you're a patient, you have orthopedic issues, this clinic really allows you to have a one-stop shop, so to speak, in the sense that you have the physicians there that can initially evaluate you, and then from there you can have your physical therapy all in the same location. And this is beneficial because a lot of times issues are going to arise as part of your medical care. And the therapists that are there, Cameron Badinger is our physical therapist, and Carrie Porty is our PTA. They are able to communicate on a daily basis with the physicians and the providers for any issues that arise. So they have that face-to-face interaction with the docs, which really eliminates any delay in your rehab, in your recovery, because any issues that pop up can be addressed right away.
Right.
The physicians can walk right back to the gym and see how you're doing with PT, evaluate any issues that may have popped up. And so really it eliminates delays in your care. You don't have to wait to hear back from your provider on what the next step should be. So it really allows for a seamless plan of care, great communication between the PTs and the physicians because everything is just kind of in-house.
Yeah. And do you think that in-house factor also kind of lends itself to, I know that when my family members have had injuries and it's like you have to go to physical therapy, but it's at a different location, some people drop off, and maybe don't even go.
Correct. So I think if you know that your doctor has advised you or recommended you do physical therapy, and he's also saying, hey, I have this great brand new clinic that I'd like you to do the therapy in, you're going to be probably a little bit more coerced or motivated to make sure you attend those appointments because again, that's part of the communication. If somebody's not being compliant with treatment, they can communicate that right there with the doc and let them know. So yeah, I think patients might be a little more motivated, and certainly, if it's convenient for them to see the physician in that location, not always, but most of the time it would be convenient for them to do therapy there
Right.
as well. So again, it's just kind of trying to streamline everything and make it convenient. You know, when you finish seeing the doctor, you can literally just walk down the hall
Yeah.
and schedule your physical therapy. You don't have to make a phone call or anything like that. You can just do it right there, all in one office.
Yeah. So another real gem, I think, as part of this expansion and as part of your physical therapy space is this new leading edge piece of equipment. I have to look at the name of it, the AlterG anti-gravity treadmill. So tell people what that is, because it's amazing.
Yeah, so you know, like I said, we have a lot of specialty therapies that we offer there, but the AlterG is really unique. So the AlterG treadmill, it actually it's based off of technology from NASA.
Oh, wow.
So it's pretty high level technology. And what it allows us to do is put patients on a treadmill that cannot put all their weight on their injured leg. Okay? So if you're recovering from a surgery or you're recovering from a fracture, and you know you're still within those healing restrictions where you can't bear full weight on your leg, we can put you on this treadmill, and based on your body weight, we can literally take off in 1% increments weight off of your body, okay? So say if you're 50% weight bearing, you weigh 200 pounds, we can dial it into where you're only putting 100 pounds through your leg
Okay.
to avoid, you know, causing any damage to the healing process. And so that allows you to accelerate the rehab process. It allows you to start working on restoring your strength, restoring your balance, your range of motion, leads to quicker recovery and your function. All because we can do this earlier in the process. So we can get you on there walking,
Right.
much earlier. Obviously, as you progress, we can start having you run on the treadmill. You know, and it doesn't even necessarily have to be a surgery or a fracture. You could be dealing with a chronic knee pain issue, maybe an arthritic knee or something, and we can take weight off of that knee that allows you to run and not have any pain. So it's a very, very specific dosing piece of equipment that allows us to really hone in on getting you right at the right exact amount. Because honestly, without this technology, you know, if a doctor says, okay, you can put 50% weight on your leg, well, what is 50%?
What does that mean?
How do I
Right.
know I'm putting 50%?
Right.
You're just kind of guessing. This allows us to scientifically dial it in and make sure that we're staying in a safe range and progress the patient much faster in the process.
So we do have, you are Director of Outpatient Rehab Services. So what does that mean? We have lots of outpatient rehab services that are available, or a smattering of selection. So where can people go besides the Bone and Joint Clinic if they need therapy and
Right.
rehab?
So like we talked about, obviously bone and joint, if you have orthopedic needs, that's definitely one place you can go. We also have the YMCA. We have a clinic in there, which is also primarily for orthopedic patients. And that's been a great location for us, especially for people that go to the gym already.
Sure.
And they get issues. It's very convenient for them. Again, that's all about convenience for the patient. So we have that location. We also have our primary location, which is on North Azalea, corner of North Azalea and Highway 21. It's actually across the street from the Bone and Joint Clinic. And there we see a smattering of everything. We see adults, we see pediatrics, we see neurological patients, we see orthopedic patients, we see occupational therapy, speech therapy, physical therapy. So we see pretty much that's our home base.
And cardio and pulmonary too, correct? Or is that there?
That's done at the outpatient pavilion.
Okay.
But we do have that, but it's at the outpatient pavilion. So we have the North Azalea location. We also have a clinic in Folsom, which also does adults and pediatrics, PT, OT, and speech. And that's where we also offer our hippotherapy, which is another unique specialty that we offer. We just recently opened the GME clinic, and we're going to have a small PT presence in that office as well.
Okay.
So that just opened this week. And then we also offer pelvic floor therapy at the Women's Pavilion.
All right.
That's the only location where that is offered. And then finally, St. Tammany also provides the therapy services in the Cancer Center for those patients that are dealing with various issues related to their cancer treatments.
Gotcha. So we have a full range of therapy options for all of your needs. So we're going to give you the phone number to the Bone and Joint Clinic for sure to schedule an appointment with PT. You would call 985-773-1494. If you would like to learn more about our other locations, go to sttammany.health. Is there anything else you want to add, Mike?
I would just say that, you can, obviously the most common way we get patients is through a referral from your provider. Doesn't have to be necessarily an orthopedist. It could be your primary care, it could be a family medicine, it could be a physiatrist, obviously orthopedist. So we get a lot of referrals from doctors, so that's one way to come see us.
Okay.
But also from a physical therapy perspective, we take patients without a referral, what's called direct access. Our Practice Act allows us to see patients up to 30 days without a referral.
Okay.
Of course, this is insurance dependent, so your insurance has to allow you to be able to go to a PT without a referral. But I did want to mention that you can definitely come see us through a traditional route of a referral or through direct access.
Perfect. Well, physical therapy has come a long way throughout the years, for sure.
Yes.
This anti-gravity business is pretty cool.
Sure, the anti-gravity is awesome. And then we hope to later this year incorporate the diagnostic ultrasound as another service at the Bone and Joint.
Wow.
We want to be able to offer that to the physicians on a consistent basis, so we're working towards that to where if their patient needs to get an ultrasound on a shoulder or a knee or whatever the case may be, that we can be there to offer those services in that office. Again, just trying to streamline everything for orthopedics into that office.
Oh, great. Well, thank you so much for coming and sharing with us this great information. We're looking forward to sharing it with everyone else.
Thank you.
And we will see you next time when you come in, because I'm sure you'll be back. And I want to thank everyone here for watching us on Healthy Living today. We'll see you next time.